Sierra Leone's Chief Minister, Dr. David Moina Senge, has brought together over 40 social agents and decision makers, among them government ministers, mental health experts, civil society organizations, and media practitioners, to look at the immediate and long-term approach to dealing with drug addiction as a public health concern. He said the engagement resulted them to cabinet conclusion, scout to find a national approach to dealing with issues of kush, drug addiction, and mental health concern generally, instead of taking unilateral decision, but emphasized that government was shying away from approaching it as a public health emergency.
If this is a public health emergency, we have a public health agency that is well established to address this. The public health agency, we all go really low, encompasses many different, all of these elements. Something where you say we're very, very important now that people don't use that expression, this is a public health crisis. Since the public health crisis, Ebola is a public health crisis, COVID is a public health crisis. And Salone does demonstrate, repeatedly say, we're able to take public health crisis and handle them very well. So, one thing that we want to say that the people that we don't write concepts, people that we don't make, we get ideas, we don't suggest, one that we don't begin to do data work already, one that we get curriculum, we don't do accountant, and we able do something. I want for there we see what we do within the next couple of weeks, 2 weeks, 3 weeks, such that by the time we Parliament will come back, we don't get all the things we need for the right set of decisions where the executive will make support. The second thing we have the one for doing AG is small, and let's say Cabinet don't say for maybe work with internal affairs, work with you for harmonize the drug laws and the conversation that we talk about from the victims to the headlines to all that, they will be different. So we want for they give or make it a priority, the harmonization of the drug laws, and that they can be one effective way, and inviting all to support that process there.
Chief of Staff in the Office of His Excellency President Dr. Julius Maada, and who until recently was the Executive Director of the National Drug Law Enforcement Agency, Abdul Sheku Kabo, gave a situation analysis of addiction among young people, explained the component of some of the substances and purpose for approach to dealing with the crisis.
Since for the past couple of years, because we don't look at the issues. Luckily, Dr. Dello, they are today, in terms of the stats, we don't even very, very closely on that. And because of that, of this background and the number of personnel and we young people that we actually take up, not just push. We only think Tramadol is also another major problem. Tramadol, the normal Tramadol we all know, the legal one is normally 50 to 100 milligrams. That is, if you get prescription, you can buy over the counter. But some of the Tramadol will see go those seeds and destroy in 250 milligram naira each pound. Now, which make them more dangerous, only just the 250 milligram. When they test them at them, so the potency can range from 150 milligram up to 710 milligram. This one are test maybe pharmacy board and confirm. So it can range from different. And because people buy, for example, Tramadol, you think it's now 100 milligrams for you to buy. But in actual fact, the content can more than 150, 200 milligrams. Then it becomes a serious matter. So the reality is, yes, we get a drug problem.
Global mental health expert Dr. Abdul Jallo shares some statistics to provide context around the seriousness of the situation, stating that the Sierra Leone Psychiatric Teaching Hospital in Freetown had been seeing a growing number of affected young people between the ages of 20 and 35. He said it was even worrying now that they have gotten some cases from primary schools.
Right now, it's not the same. because of the impacts of the push. And now young man between the ages of 20 to 24 years, most of the youthful age. Then we also see the push from 2020 we have compiled the data because we start to take data from 2018. Yeah. But I decided to take 2020 because actually we did see an issue of drug abuse, and actually we able for validate the tool what we use for collecting data. So we push from 2020 to 2022. 2020 now be 47. 2021 now 116. Then 2022, 1,101 people in the senior hospital represent with issue of push.
Other contributions from civil society groups, interested groups, and the Attorney General and Minister of Justice, Mohammed Lamin Tarawali ASQ, agreed on the use of law as a punitive measure and other community public engagement.
The issue is on drugs, the abuse of drugs. We get several laws in. And for the most part, when they can charge them in court, we are responsible. You cannot blame the police, I don't blame I don't blame the judiciary. We all responsible. For the most part, when they can also they charge them to court. Even under the Pharmacy Drug Act, they can charge them. So when they charge them under that, there are so many offenses. The maximum is 2 years. So when they go court, evidence in the sense the exhibits not available. They can continue for the go court to some point. We all know natural justice, you keep somebody in the court very full. If the court said things say this man can not even witness for prosecuting case, they can just discharge the person.
In the closing remarks, the Chief Minister observed that engagement was critical to dealing with public health crises, generally through the Public Health Agency, adding that Cabinet had also agreed that the Ministry of Internal Affairs could work with the Office of the Attorney General to harmonize laws on Drug Enforcement Administration. For Star TV News in Freetown, George Elliott Sam reporting.